My name is Gina Ford. I'm the Communications Director for Prince George's County Executive, Angela Also Brooks. We'd like to thank you all for joining us this morning at Luminis Health, Doctors Community Medical Center, because this is absolutely a beautiful day in Prince George's County. Of course, right behind us here, you'll see our new Behavioral Health Pavilion. And today is a day that Prince George's and this medical system are taking an important step together in furthering care for those battling mental health illness and addictions. Joining us are members of the County Executive's Administration, members of our County Council, members of the Luminis Health Doctors Community Medical Center Board of Directors, and the Board of Directors, the Foundation, the Board of Directors. Members of the hospital staff and support staff are here with us as well. And first this morning, we would like to welcome County Executive Angela Also Brooks, who initially, as the top prosecutor, observed the troubling trend of individuals coming through our criminal justice system struggling with mental health and addictions. She made addressing these issues priority in her administration, and today we are so happy to collectively take a step forward. Madam Executive.
Well, good morning, everyone. I think saying that this is a beautiful day is an understatement, and you may say, well, how so? It's a little cloudy out, maybe even a little chilly, but great things are happening today in Prince George's County, and I hope that you feel the excitement that I do. We're breaking ground today on the Behavioral Health Services building here at Luminis Health Doctors Community Medical Center. And I want to begin by saying thank you so very much to President Deneen Richmond, Luminis Health CEO Victoria Bayless for your presence this morning, and thank you as well for the collaboration. I see Dr. Carter, want to thank him. So glad to see him this morning. And I also want to thank, in his absence, Council Chair Hawkins. I know that we are also joined by Councilwoman Danielle Glaros. Want to thank her. Senator Paul Pensky, thank you so much. As well as, and I haven't seen him yet, but Delegate Alonzo Washington, I believe, may be planning to join us this morning. I also want to acknowledge a few folks from our government. Our Chief Administrative Officer, Tara Jackson. Former Chief Administrative Officer Major Riddick is here. I want to thank, he's been very, very instrumental. I think he's the person who is at least as excited as I am today about this. Chief of Staff Joy Russell will not be able to be with us this morning. She was working on some other matters. Our DCAO for Health, Human Services, and Education, Dr. George Askew, want to thank him. As well as, again, Dr. Ernest Carter, who we just owe a huge debt to, who has just been tremendous throughout this whole year, as well as Dr. Belina Shaw from our health department, who has worked so very hard to make sure that this project move forward. Today's ceremony is a very meaningful one, and it is meaningful because it breaks ground on a discussion that has not been treated as a priority often enough. The groundbreaking of this facility highlights a need that is long gone underserved. For years, Prince George's County has been a behavioral health desert. In 2019, the Prince George's Community Health Needs Assessment identified behavioral health as a leading health priority for county residents. We have nearly 1 million residents, but we have only 2 acute care units for inpatient behavioral health. As a result, more than half of the 1,900 adult admissions from Prince George's County were admitted to hospitals outside of our jurisdiction. This cannot stand. We can do and will do much better. We've also seen this lack of access to adequate treatment, as you heard Gina discuss, reveal within our criminal justice system, because people in a mental health crisis are more likely to encounter police than get necessary medical help. And when I was state's attorney, I saw this up close and personal. And over the past few years, what we saw play out every day, day in and day out in the hallways of that courthouse, played out where we saw nearly 1/3 of the inmates in our detention center have been found to be on medications for mental health conditions. And as many as 70% of the people who arrive every single day at our correctional facility here in Prince George's are intoxicated when they get there. This is the devastating price that communities like ours pay for poor access to health care, and it's something that I have sought to change ever since. When I took office as county executive, I made expanding mental health services a part of my proud priorities. And while we were working toward treating mental health more adequately, the COVID-19 pandemic came along and it has only magnified these challenges within our community. Last summer's social justice movement protesting police violence swept the nation, and we were also confronted with incidents involving our own police department. I decided that we could not wait any longer to do something significant to decrease the interactions between police and those suffering from mental health and addiction. That critical moment was an opportunity to reimagine how we would use our resources and how we might attack these long-standing challenges. And so to that end, I sent enabling legislation to the County Council to shift $20 million from the building of a public safety training facility toward the construction of this mental health facility that we're standing in front of today. Thank you. The County Council agreed that we could not wait any longer, and they approved the measure to go on the November ballot. I want to thank this council so much for their strong partnership. Our residents who have expressed their need for behavioral health care also agreed that we could not wait any longer. They approved the legislation during the November elections, and so through this partnership with my administration, our county council, Luminis Health, and Prince George's, today we break ground on this priority. I sincerely want to thank our partners at Luminis because when they heard about our intention to increase access to mental health and addiction services, they approached us and said, what can we do to be a part of the solution? And guess what? Here we are today. This is a priority because our residents should not have to leave their county to seek necessary treatment. And you know what? I could actually go on and on and on about that particular point. I won't do so this morning, but let me just tell you how strongly I feel about that. There is no reason under the sun that Prince Georgians should ever have to leave Prince George's County to get the necessary treatment that they need. If we didn't understand that, we understand it like never before after COVID-19. And this is a moment we want to make sure we never, ever return to what we saw during this pandemic. And so it is a priority because I believe that it is fundamentally wrong to treat mentally ill and addicted people in jail. Our residents deserve to have their dignity preserved, and they deserve to be treated in an environment that is conducive to healing. Jail is not conducive to healing. This facility is conducive to healing. And because we've made it a priority, this two-story 31,200 square foot center will give our residents access to a wide spectrum of quality mental health and substance use disorder services. And even better, at a time when we've seen historic unemployment due to this pandemic, this expansion will add approximately 100 jobs to the Luminis Health Doctors Community Medical Center. So today is a special day for our county, and I want to thank you all for joining us. I want to thank Luminis Health for believing and behavioral health is a priority as well. Let's continue to work together to improve the health and well-being of all of our residents, and let's keep moving forward as a stronger, healthier Prince George's County. Thank you so much.
Thank you, Madam Executive. I would like to next invite Victoria Bayless, Chief Executive Officer for Luminis Health, to the stage. She joined Anne Arundel Medical Center as Vice President of Clinical and Support Services in 2005, was promoted to COO in 2006. In September 2009, Ms. Bayless was named President and COO and promoted to CEO in 2011. She has over 25 years of experience in management and leadership, specializing in strategic planning and health systems operations, to name a few. Exactly. You're welcome. Here you are.
Thank you very much, Gina, and thank you, Madam County Executive. We could have an informal competition here about who's the most excited about what's happening here today, and maybe we'll just simply declare it all a tie. Thank you very much, County Executive Alsobrooks, for your leadership, for initiating this very important partnership, and for allocating the capital resources to get us going. So good morning, everyone. I am thrilled to be here with you today. This really is a momentous occasion for Luminis Health working in partnership with Prince George's County. This is about providing patient-centered behavioral health care services to people close to home. We're trying to bring this expertise right into the neighborhood, so as the county executive said, people don't have to leave to get their care in Washington or Baltimore or leave the region to get such needed services. So we are very excited and grateful for the support of the county executive, the county council, the Prince George's delegation, the mayors, the city councils, and all of those who supported what is now a certificate of need application filed with the state to be able to expand and offer these much needed services. This partnership is really about removing barriers, having expertise within reach, and providing that care close to home. This is a partnership that can benefit the entire region and address behavioral health care needs so clearly articulated in the county's community health needs assessment. We know all too well that these mental health needs have been exacerbated over the past 16 months through the pandemic and through the profound social injustices, unrest, and racism witnessed over and over again in our communities. Luminis Health came together as a system less than 2 years ago in July of 2019. Our boards of trustees, many of whom are with us here today, recently approved what we call Vision 2030, Living Healthier Together. It's a broad strategic plan that will guide us through this next decade. And while that sounds quite lofty to put forward a 10-year vision, we were deliberate in setting a long horizon so that we could think big and act boldly in setting our goals and what we want to accomplish together. We're not trying to predict the future by any means, but we are trying to set the course to innovate, partner, impact, and create that future. By expanding the Luminis Health behavioral health services programs into Prince George's County, we will light the way towards healthier minds, bodies, and spirits. We are igniting a new era in healthcare, bringing together diversity and the many facets of our community, brightening tomorrow for all of us. Luminis Health is part of a much larger health ecosystem. Our Vision 2030 demands and welcomes and celebrates very specific and deliberate partnerships such as this one. While we are a large system, we cannot do this alone, and again, we are incredibly grateful for the partnership with Prince George's County. Honoring our past and being aspirational about our future, we have defined 4 new core values for Luminis Health: respect, inclusion, service, and excellence. With the acronym RISE, these values will not only be known to our 9,000 team members, but brought to life every day in how we behave and care for our patients, families, and each other. To quote Robert Ingersoll, we rise by lifting others. So this new behavioral health program puts our values into action as we rise to meet the needs of our community. Health equity is central to the Vision 2030 of Luminis Health. Our commitment to increasing equity, disrupting biases, and decreasing disparities in care and outcomes are central to this plan. The plan actually states that Luminis Health will become a national model for diversity, equity, inclusion, anti-racism, and justice by implementing the recommendations and goals of our Health Equity and Anti-Racism Task Force. We call this the Heart Force, and we have several members of the Heart Force with us here today as well. We know that our humanity is enriched when everyone has a voice and diversity of perspectives are equitably represented and included. Our Heart Force will play a very important role in this new behavioral health program as we develop culturally, linguistically, and racially appropriate clinical programs and services. Patients and families deserve this. I know we all agree on that. And this new facility and the programs and services that it will house will be providing safe, welcoming, private, and accessible care in this new environment. The new behavioral health program at Luminis Health Doctors Community Medical Center is truly transforming our mission of enhancing the health of the people and communities we serve into a reality. So we are thrilled to be here in partnership with the county. We look forward to the future ribbon cuttings and the approvals and guidance in working with the state and the regulators to bring this all to life. Thank you very much, and I'll turn it back to Gina.
Thank you so much, Ms. Bayless. So next, it's a privilege to welcome Dr. Ernest Carter. As the county's health officer and a physician for more than 40 years, he has a deep understanding of the wellness needs of our communities and the importance of expanding these critical health services. So please, Dr. Carter.
Good morning. I'd like to thank you, Madam County Exec, for your tireless leadership. I'd like to thank the county council members, in particular, Councilman Glaros, for your all's leadership in this. I think I am the most excited. I'm sorry. It's me. I'd like to thank Luminis Health, the CEO, Victoria Bayless, for you all's cooperation and work with us, this partnership, and also Dr. Community Hospital President Deneen Richmond. I mean, they just have worked with us with a tireless and dedicated force to make this happen. I'd also like to thank Dr. Belina Shaw. I'm looking for her. She has worked so hard. She is from our health department's behavioral health division, and she has worked very hard on this. And again, lastly, I'd love to thank Major Riddick, because his work and his leadership in coordinating all of these moving parts has just been remarkable. This collaboration is a true commitment to Prince George's County residents during this time of great need. As the county's health officer, it's my mission to improve, promote, and preserve the health and wellness of Prince Georgians. Therefore, it's no surprise that I am very excited about this project and the difference it can make for our communities. What will soon be here is not just a building for residents to get the care they need, but it also serves as a building block to expand local access to behavioral health care. This is a big first step in creating a robust network of care throughout Prince George's County. We need to make it easier for every Prince Georgian to get health care where they live. Being healthy is not just about physical health. Improving and maintaining our behavioral health is vital to cope with the challenges we encounter in life. Physical health and mental health are connected, but sometimes we don't recognize the bridge between the two. Projects like this will help build the infrastructure to provide comprehensive, direct patient care and raise awareness in the community. I want to be sure Prince Georgians know you can get help here in Prince George's County. We can improve your mental health or end your addiction, or both. You can get the treatment and services you need right here. The COVID-19 pandemic has been a harsh reminder that we have nothing if we don't have our health. The Luminis Health Doctors Community Medical Center is a public-private partnership that will help our families, friends, and neighbors get better and lead healthier lives. I'm excited about the path we're on, investing in public health, ensuring there are greater local access to the continuum of behavioral health care for our residents, because they deserve it. Thank you very much, and be safe out there, and make sure you keep each other safe. Thank you.
Thank you, Dr. Carter. So next, I'd like to welcome Deneen Richmond. She's the president of Luminis Health Doctors Community Medical Center. Most recently served as Chief Quality and Population Officer for Luminis Health. Prior to that, she served as Vice President of Population Health at Anne Arundel Medical Center, and I have personally had the pleasure of working with her and her team in order to help to promote vaccinations. So, please go.
Thank you, Gina. So, Everybody's excited. So I'm going to say I'm beyond excited. I'm ecstatic that we have reached this wonderful day. My heart is truly filled with gratitude this morning. So I want to first start out by thanking some of the individuals who really made this day possible. And you've heard their names already, but I would be remiss without thanking them again. So first, I want to thank our County Executive, Angela Ossobrooks, for her vision to enhance behavioral health services in Prince George's County. I am so grateful to you, the entire County Council, and your entire administration for your generous investment of a $20 million grant that is literally allowing us to build a behavioral health program here at Luminis Health Doctors Community Medical Center. We truly understand the strength of this partnership and look forward to growing the program with you as we begin and then continue to meet our community's behavioral health needs. I'm also very appreciative for Ms. Tori Bayless, Chief Executive Officer of Luminis Health, for her vision to form this health system to ignite a new era of enhancing the health of the people and communities we serve, and for all of her support for this new behavioral health program here at Luminis Health Doctors Community Medical Center. Certainly, I also want to thank and acknowledge my doctor's board members, as well as our foundation board members, and all of my Luminis Health colleagues for all of your support and for being here today. I appreciate everyone who collectively worked together to make this day possible. On a personal level, today is also an immensely proud day and moment for me. I am proud to be a lifelong Prince Georgian. I am proud to be a graduate of the Eleanor Roosevelt High School Science and Technology program that is just a few miles from here in Greenbelt, Maryland, and I am so proud to have this opportunity to serve as president of Luminis Health Doctors Community Medical Center. This is the first time in my long career that I have an opportunity to directly give back to the community who has made me who I am today, and I am forever grateful for that. We are here to serve the residents of Prince George's County, and as you've heard, behavioral health is one of the major needs. In the last year, we have seen an incredible rise in the need for mental health services. I believe that we all know that particularly during this pandemic, and even prior to COVID, there are a number of people suffering with mental health and substance use disorders who are unable to get the care and treatment that they need and, most importantly, deserve. In fact, 1 in 10 residents has mental health needs, and we know that there are limited resources in Prince George's County. We also recognize that some of the resources that previously existed in and outside of the county are no longer available. When we look at the community health needs assessment and some of the other statistics, we also know that we rank near the bottom for the number of mental health providers that we have per resident. We know that half of county residents who have required inpatient mental health care have had to leave the county. So all of those statistics point to how important this facility will be. This facility will go a long way toward addressing the needs of Prince Georgians to receive quality behavioral health care and services close to home. We are renovating this building on our campus to offer ambulatory as well as inpatient services pending the approval of our certificate of need that was submitted to the state on April 9th. The services that we will offer here are based on the best programs we have observed around the country and our own expertise in delivering a patient and family-centered model of care at the McNew Family Center in Annapolis. This behavioral health campus will be a place where patients with mental illness and addiction can find specialized, focused programs and services, and where clinicians and staff can provide comprehensive, coordinated, culturally sensitive, and compassionate inpatient and outpatient care. Through our strong, vibrant partnership with Prince George's County, The outpatient services available on this campus will include mental health residential crisis services, a walk-in urgent care center with extended hours to provide an alternative to residents seeking care having to go to a hospital emergency department, an outpatient transitional clinic that can provide therapy and medication management to bridge someone coming from inpatient or elsewhere until they get long-term community placement, a mental health partial hospitalization program, and an intensive outpatient treatment program for mental health and substance use disorders. We are committed to opening the outpatient services by December of this year. And once we receive approval from the state, we will build the second floor inpatient unit. As a new leader at Luminis Health Doctors Community Medical Center, I am honored to serve the community and truly improve the lives of all Prince Georges. Again, thank you for all of your support. I invite you to continue walking on this journey with us as we improve the health and well-being of all Prince Georgians. Thank you.
Thank you so much. And last, but certainly not least, representing our county council, we have County Councilwoman Danielle Glaros of District 3. She's a longtime advocate of social services and behavioral health, and we're also so very happy that this pavilion is in your district.
Good morning, everyone. As was said, I have the honor of being the final speaker, and everyone before me was really excited, and I get the honor of doing the closing remarks and being, as you can imagine, as equally excited as everyone who is here today. And the rain has gotten heavier as we have started, but I don't think that has diminished how thrilled we are to be at this moment in time here in Prince George's County. So let me start with a few thank yous. First of all, as was mentioned, I'm County Councilmember Danielle Glaros, and I have the honor today of filling in for my chair, Councilmember Calvin Hawkins, who with the rest of my colleagues are in the midst of budget discussions for the next several hours. And so I'll be joining them after this moment. And I also want to particularly start with thanking Luminis Health Doctors Community Hospital. It's been an honor to represent this area. It's been an honor to be with you all, to see you grow, to hear about your new 10-year plan, and to frankly see you, in essence, doing that already in our community, to see the partnership around our vaccine clinics, whether that's been at Reed Temple or the one in my district at St. Bernard's, where we clearly know we are touching our most vulnerable residents, our seniors, those with limited access to computers, to email, to cell phones, who desperately need access to the vaccine. And so I really want to thank our CEO, Victoria Bayless, and really thank President Deneen Richmond, because you have already been living those ideals you mentioned for the 10-year plan, and I can't possibly imagine what's to come in the amazing partnerships ahead. And I also really want to thank County Executive Angela Alsobrooks and her entire team, Dr. Carter, Dr. Askew. County Executive Alsobrooks and I, before she was actually officially sworn in, I remember us sitting together at OTI down in Upper Marlboro. And I was at that point chairing the county council. And her and I had a very long conversation about health and social services needs here in Prince George's County. So she came in with this passion, as was described from her work as state's attorney, and knew from the beginning how important it was to deliver on health and human services and social services. So I really remember that conversation, remember us talking about the data, which you've heard a lot of today, and her interest in, and I know that we would impossibly be at this moment if it wasn't for this administration prioritizing behavioral health here in Prince George's County. So from the bottom of my heart, I want to thank you and your team for all the work it took to get here. And Major Riddick, I know you're not officially part of the team anymore, but you will always be part of the Prince George's County team. And as was said, this really does matter. It's not just about building the inpatient clinic, which is desperately needed for our residents here. It is also about the urgent care and outpatient clinic. There are way too many examples that I could point to just in this last year alone, where this service had been up and running, we might have seen different outcomes in our community. And I don't have to go far from Doctors Community Hospital Luminis Health to actually point to that. We lost 2 lives just less than a year ago, a few miles from here. And luckily, the young son is still alive, but we lost a sister, we lost a brother, we lost a family member because of a behavioral health crisis that ended up in 2 lost lives here in Prince George's County. And then as parents like myself, who have all, I think we've all sort of had these experiences through the pandemic, I know that so many parents like myself have needed to seek care for our kids. I found myself one night at Children's Hospital down in DC wondering if I was going to bring my child. And the reality is it took weeks upon weeks to find a local behavioral health appointment. And now she has a regular counselor, but not everyone can access that. You leave a hospital with a list of possible names who may or may not have slots for the care you need. Having the urgent care, the outpatient facility here for both kids and adults is going to be so well used in our community. And as Dr. Carter mentioned, it really will ensure that people know they can get help and take behavioral health out of the item that no one oftentimes wants to talk about and put it front and center and say it is okay to seek help in your community. And not only is it okay, it is incredibly easy to be able to do that. So this is an incredible moment here in Prince George's County. The steps that the administration made to shift funding to prioritize this, the benefit of an amazing partnership with Luminis Health. It doesn't come together like this very often. But I'm excited about the possibility and excited for us to see even more partnerships exactly like this. And as I mentioned earlier, I happened to chair the council a few years ago, and I had the honor actually of giving the inauguration speech on behalf of my colleagues. And I close with these 3 lines, which I often come back to, because I truly believe that moments like this we need to make more of here in Prince George's County. And moments like this do not come about unless you have partners and collaboration. And so I'm going to close with those 3 lines I said several years ago on a big stage in Upper Marlboro. Only together can the gifts of Prince George's County be shared and unwrapped by all. Only together can we strengthen our county, our communities, our families, and realize our fullest potential. Only together as one county can our tapestry, our story, and our county shine bright. So thank you again for all the work that went into this building. I can't wait to set foot in it. And later this year, it is hard to believe it'll be open in December. So thank you again for everyone involved and for all of our future collaborations and partnerships to deliver real results for Prince Georgians. Thank you.
Very well said, Council Member. And with that, I'd like to thank you all for coming. Again, this was a very important collaboration, and so this is going to provide world-class mental health and addictions care, and it's going to provide access to Prince Georgians right here in Prince George's County. So again, thank you all, and if we may please have our speakers join us here at the Dirt Box for the ceremonial groundbreaking. Thank you.
We'll get a pose and everybody just in a holding position, okay? Right here?
You guys are smiling under those masks. Yeah. You see like smiley eyes.
Yeah. Okay. Y'all good out there? Okay. Now the first one I'm supposed to go in about a foot. Yeah.
There's a technique here.
Yeah. And go down, dig a little bit so you know you're getting a little something. Go ahead and get something. Feel it out just a little bit. Feel it out. Make sure you got something on your shelf. You need a little bit more on your shelf. Yeah. Okay. Yeah. Okay, you ready? Does it feel like you pick it up? Okay. All right, we'll pick it up first. Shot for picking it up. Okay, and then we're gonna toss. Okay. Pick up, hold for about 4 seconds. Toss. Okay, good job. Great job.